When someone applies for a green card or admission into the United States, their application is determined by different factors. One of them is whether or not they will be a public charge. An individual is considered a public charge if there is a possibility they will rely on public benefits like temporary assistance for needy families and supplemental security income. Immigration caseworkers consider factors like age, health, financial status, and education and skills to determine if someone is likely to use those public benefits. But the Trump administration announced in September a proposal to expand the number of benefits to be considered in the future. The new benefits would include the Supplemental Nutritional Assistance Program, also known as food stamps, housing vouchers like Section 8 housing, Medicaid, and Medicare's Part D low-income subsidy. Only those who are likely to use or have received these benefits will be affected, and only after the regulation is finalized, which is still not certain. The proposal was up for public comment until December 10th. If adopted, the rule could go into effect early next year. Department of Homeland Security Secretary Kristen Nielsen said the rule would promote immigrants' self-sufficiency and protect finite resources by ensuring that they are not likely to become burdens on American taxpayers. But officials across the country are denouncing the regulation because it could jeopardize immigrants' health. In New York City, Mayor Bill de Blasio's office estimates 75,000 immigrants eligible for these public services would be forced to give up their subsidies for a chance to gain a green card. The new regulation is also expected to impact children, New York State health centers, and Medicaid. There is also concern among service providers in New York City whose immigrant clients living with HIV have become reluctant to continue or seek treatment through their Medicaid benefits because they are worried they will be labeled a public charge. Medicaid is the largest source of coverage for those with HIV and helped curb the HIV epidemic nationwide. If the proposal goes into effect, service providers worry non-citizens living with HIV could be forced to choose between their hopes for a green card and their need for drug therapies, physician services, and access to PrEP and HIV testing. Conducting HIV testing outreach to especially vulnerable immigrant populations could also become even more difficult if clients are afraid of being labeled a public charge. Latino immigrant men who have sex with men have cited cultural factors like religion and machismo as obstacles to getting tested. And immigrant transgender women are at a high risk of infection because of financial struggles, discrimination, and stigma. HIV infections in the United States and New York have declined in the past few years, but service providers worry the exodus from treatment would threaten a chance to end the HIV epidemic.